So Jamaica is now heightening its preparation for the coronavirus, which has so far been detected in 3 Caribbean countries. Jamaica's Health Minister, Dr. Christopher Tufton, is a part of that core team helping with the preparation for the COVID-19. Let's start with what is latest in the paper that happened today, that of an apparent standoff with Carnival Cruises in respect of docking here in Jamaica with its ships. What's the latest in that?
Well, we have some differences in terms of the established protocols. I mean, they have indicated that they are not fully abreast of those protocols, and as a consequence, we have to dialogue to clarify to the extent that they are uncertain about what we are requesting of them. But many of these protocols have been established for a very long time. We have adjusted somewhat because of the coronavirus to get more information, such as a temperature log of the guests on board, because that would give an indication of the illness profile or lack thereof, and of course restricting nationals from countries that are on the restricted list. So we have made some adjustments, which we are allowed to do. Every country, every sovereign country is allowed to do. So we're going to have a meeting with their representatives today, and I'm hoping that we can clarify. But ultimately, it's about protecting our local population, and so the decisions that we take are going to have to be driven fundamentally by that.
No doubt there is a core team which is responsible for the preparation and overall management as you continue to look in strengthening your own facilities to ensure that we can handle the COVID-19 should it reach Jamaica. But who are the members of that core team?
So the core clinical team would be headed, of course, by the chief medical officer. And under her jurisdiction, you would have a number of other critical medical team members, clinicians who cover a range of areas under the Ministry of Health's portfolio. So emergency management, epidemiology, and a number of other areas. In addition to that, of course, we have the regional heads, regional technical directors, who manages the operations at the regional level under the Ministry of Health regional authorities. Beyond that, though, on the other side would be the permanent secretary. And there are a number of other non-Ministry of Health stakeholders that we've been having discussions with in the private sector. Now, the governance structure in this case would fall under the National Disaster Response Committee chaired by the Honorable Prime Minister, which is a multi-stakeholder, multi-agency, private-public NGO committee that would provide or at least approve and help to coordinate the broader framework of a response. We are going to be having a meeting on Thursday morning. The Prime Minister, of course, will chair that meeting, and the Ministry of Health will make a presentation as to the what-ifs, which means what if the virus were to come? What is the plan? And we have developed a plan. We're refining it now, and we will provide the country with some of that information after Thursday.
Well, let's go right there, because that's one of the concerns. What if the virus should hit Jamaica? Are there adequate supplies, for example, of reagents for testing? Are there adequate supplies of masks and other protective gear?
Right. So in medical science and in the planning for an event, we use historical data and make certain projections and under the general ambit of epidemiology. And we have done some modeling as to what could be the possible scenarios in terms of number of persons affected based on the history of the virus. And we've been looking at the history, short history, but nevertheless, in other countries. So we have an idea, or at least a sense of how we think the virus will, if it were to come here, would have impact us, and therefore what we would need in terms of hospital beds, isolation areas, quarantine facilities, and so on. So that plan would seek to look at how we would approach that, who are the critical agencies that would be involved in that process. I mean, the Army, suppliers, because sometimes you may have to restrict movement, restrict congregation of persons. Certain events may have to be postponed or cancelled.
You're hinting at an election postponement?
And then, no, not at all. And then, of course, on the clinical side, it may require, or it would require, entire wards of hospitals to be dedicated to isolation facilities for that particular purpose. Maybe even a hospital that would have to be vacated and preserved just for that purpose.
But as we speak, are you satisfied that there are enough equipment or
Well,
material?
look at it this way. It's based on your modeling, you put those infrastructure in place, and so you may need to improve the number of supplies that you require. But clearly, the extent of the need is a function of the extent of a possible outbreak. So you plan, but there are always margins of error in that, and that's why the collaboration with the PAHO, WHO, is so important. So we are putting a plan in place based on certain assumptions, and based on those assumptions, we would be in a position to deal with a possible outbreak.
Training of the frontline workers is another key issue. I did hear some public health nurses making complaints, certainly in respect of those who are on the ports, as it relates to how equipped they were to approach persons who may be suspected of having the virus, or at least having symptoms, certainly on the cruise ship. What's happening with the training of the frontline workers?
So there's a number of training sessions going on currently, sensitizing our frontline workers about the nature of the virus, how it should be dealt with, and so on. It is an ongoing exercise, and it will continue. We're humans, so there's always going to be some fear of the unknown. And the fact that this virus is novel, it's new, persons would approach with caution and would want to take extra precaution based on what they have seen. This is a very topical issue. It's been trending and talked about everywhere in the world. So I fully appreciate concerns that are raised. We, however, are charged with providing the leadership, and right now, the best practice, as outlined by the WHO and others, is to provide training, provide public education and information, and to equip both the infrastructure and the personnel to deal with the issue in terms of the curative side, as well as some other actions on the prevention side. And we're doing that, I think.
But to get back to the point, though, the public health inspectors, certainly those who are public health nurses, certainly those who are working in St. and believe that they do not have adequate training, neither do they have adequate supplies, protective gear. Are you seeing this as a concern, and is it being addressed?
Well, I am prepared to listen to all the concerns of our public health staff, because they work hard and they are very essential to take care. So to the extent that there are specific concerns expressed, I am prepared to listen and to adjust where necessary. In fact, this week, I'm planning to visit the ports in Montego Bay, both sea and airport, and the seaports in Ocho Rios. And part of that visit is to actually hear what their concerns are, if those concerns continue. So we have a very responsive approach, or I'd like to promote a responsive approach. So yes, definitely willing to listen.
Recently, the health ministry, which you lead, indicated that there would be travel restrictions for 5 countries, including China, and also announced that there would be quarantine for those Jamaicans returning home from any of these countries. And there was this introduction of a term, home quarantine. How will home quarantine work?
Well, it's working now. We quarantine, and quarantining just means that because of your travel history, doesn't mean that you have any signs or symptoms. Because of your travel history, and by extension, the exposure that you may have had in that environment, we hold you for a period of 14 days to see if you actually have the virus, which is the time the virus takes to demonstrate symptoms, which is when it is contagious.
Where are you held?
So we have 4 facilities that are government controlled. And those facilities, we place persons who, in the estimation of the clinical staff that assesses that person, feels that that person may have been more exposed and therefore should be placed in that facility where they are monitored a lot more closely, to the extent that the risk is not as great. So someone may come from a country that is under surveillance, if you will, as restrictions, a Jamaican, but they were in a city in that country where the virus was present, then they would be assessed as a greater risk than someone who may have been on the other side of that country. So they take a decision on home quarantine based on the risk assessment, but the home quarantine is also dependent on the nature of the home. So if you have a house that allows you to be isolated, isolated in the general sense of the term, where the medical staff can check on you periodically to do the temperature checks, where they are confident that you will observe the arrangements, then they would likely do the home quarantine. If you don't have the facilities, you live in a home with 50 people, and there's no way you're going to be staying in one space on your own, then they wouldn't qualify. So it's a function of the travel history and the facilities that they have.
But isn't there not an inherent risk in that same home quarantine approach that the ministry has been taking?
There is a risk in everything that we do. None of the strategies that we're employing are totally risk-free. That's just the reality.
Well,
which is why the assessment determines the extent of the risk and the extent of the risk that we are prepared to take.
Let's move then now to people who are traveling. There is a part on your immigration form that requires you to say where you're coming from. Is the ministry relying solely on the honesty of travelers to indicate where they're coming from?
Right. So we also depend on the collaboration with the immigration officials and to some extent the airline industry, because if someone books a route from China, say, via New York or London, and they're going straight through from one point to the next, then that information actually is shown and can be provided to us. However, risk again, if someone decided to fly from a country that is under quarantine to a third country, spends a few days, and then books a separate flight to Jamaica, unless the person is willing to share that information, it would be very difficult under any circumstances to track that. So yes, we have to rely on the honesty of individuals, recognizing hopefully that those persons would be sufficiently concerned about their own health and safety, that they would be truthful. But there are ways also, depending on how the flight arrangements are made, to get information on the person's travel history.
And are those ways being actively pursued? I mean,
we use, yes, but not in all cases you have that information. So to the extent that you can, yes, we use that information.
It takes cash to care, one former prime minister had said. How much is the ministry setting aside to deal with this preparation?
I don't have a figure now, but we have been spending some resources. I think part of the plan that we will present on Thursday will also include a budget. So I know they're working on it, so we'll have more specifics on that. But it is taking some resources without a doubt. The quarantine facilities alone, feeding persons that you hold in the quarantine facilities, working extra hours, all of those things will definitely have a cost. But there's no price that's too much for saving a life, and in this case, to trying to prevent or delay. And I stress delay because there's always the possibility that the virus could come here. Delay in itself is a strategy because it gives us an opportunity to plan for if and when it comes. And we have to do what we have to do.
And how many people do you now have in quarantine, if any?
It changes almost daily, but I believe we have about 15 persons. We have had in quarantine over 100 persons to date, and we have refused landing for over 30 or 40. So persons on the travel restricted itinerary would be turned back on the next flight.
There remains, though, Dr. Tufton, a lot of anxiety, certainly in the public space, in respect of this COVID-19. But if there can be any reassurance or tips at this point for people who may be looking on and are feeling anxious, what would those be?
Well, first of all, I think it's important that persons do not panic. I think it's very understandable to show concern, but not to panic. And one of the things that we have to do is to reassure persons that the government is taking all the necessary steps. Secondly, I think it's important that persons, to the extent that they can, inform themselves. Now, we are doing public education programs. This is a good one, and we appreciate it. But, you just need to go online or, read the papers, you watch the television. It's important to appreciate what this virus is, how it can be spread, and then hopefully learning from that, because proper hygiene is a fundamental response to the prevention or avoidance of actually having the virus. And the virus is spread by droplets. So, the everyday etiquette of touching, and, we're touchy-feely people, staying within reach of someone coughing or sneezing. We have to suspend those, we have to be careful to avoid those settings at this point in time, and certainly if the virus were to come here, even more so. Beyond that, I think it's important to listen to the advisories that we put out and work with the government and the technicians, the clinical technicians, because any plan we put out is aimed at protecting the population. So, and we crave the cooperation. And finally, vigilance. Jamaica is a small island state with a sea mass that's many times bigger than Jamaica. And while we have the official ports of entry that we can monitor, there are unofficial ports of entry where people move between one country and the other for legal or illegal things. And it's important that as citizens we observe in our environment strangers who come in, persons who show obvious signs, and report to the authorities, because it is better for us to check and be certain than to allow the virus to spread or to be introduced into the country. So I think all of us have a role to play, and I'd certainly encourage our citizens to engage the process in that way.
And just for clarity, the virus has been detected in the Dominican Republic,
right?
Which means that Haiti, which is its neighboring country, has a relationship with DOMREP and also with Jamaica.
Mm-hmm.
We have
exactly.
a history of the guns for drug trade and people coming in.
Exactly, exactly.
All right, thank you so very much, Dr. Tufton. I'm taking it that the ministry will soon be launching then massive public education campaign.
Well, we have a public education campaign going now, but it will be adjusted to accommodate the circumstances. And again, after Thursday's meeting, we'll report back to the country in terms of some of the more specifics around the response.